My career goal is to be a surgeon scientist. As I said, always tell my friends that the medicine will be the same tomorrow as today if we don't do any research. The reason we're doing such a great work today for our patients is because we did a lot of research. Our pioneer did a lot of research in the past. So I want to continue this path to be a surgeon scientist. This award inspires me and tell me our leadership pay attention to the young surgeons to be a surgeon scientist to advance our field. And also this award give me a lot of support. From in my early career, my department was very excited about this award too. So my research has two directions. One is about the mechanism of aortic aneurysm, especially in bicuspid aortic valve patients. Bicuspid aortic valve patients is the most common congenital cardiovascular disease. About 20 to 50% of those patients have aneurysm. However, we pretty much know nothing about this disease, why those patients develop aneurysm, what's the mechanism, because we don't know the mechanism and we don't know how to treat those patients to prevent the aneurysm formation. My goal is to study this mechanism. Hopefully, we can develop some novel therapy to prevent the aneurysm in bicuspid aortic valve patients or any other aortic aneurysm patients. Second direction, I'm collaborating with a vascular biologist and a bioengineer, and we're doing tissue-engineered blood vessels. We use patient-specific induced pluripotent stem cells to generate the blood vessels. And those blood vessels will be infection resistant, hopefully, will have great growth potential. So when we implant those grafts into the patient, they have less chance to get infected. When we implant those grafts into the children's, they have growth those grafts have growth. And then they will grow with the children, and the children won't have multiple operations. So that's two directions of my research. I have two things I want to tell who wants to be a surgeon scientist. Number one, don't lose your goal. To be a surgeon scientist, first you have to be a very good surgeon. You got to take good care of your patients. That needs a lot of work. To be on top of that, you want to do research, be a scientist, you have to do a lot of extra work, spend a lot of extra time for your research. So when you get tired, don't lose your goal. Number two, you need a right environment. You need great support from your department, your chair, and your institution. So I really appreciate this award. It's an honor for me to get this award. And this is the first award I got, external funding, first external I got. And after that, I continue writing grants. Actually, I got another award, and I'm writing more grants. I hope I can keep going, get more awards, and continue my scientific career. Thank you.